All right, next is ITP, idiopathic thrombocytic purpura, or idiopathic thrombocytopenia. Okay, so what are we talking about? Thrombocytes or platelets. Penia is not enough. So this is a patient who, for no apparent reason, idiopathic, is losing platelets or doesn't have enough platelets. This is thought to be autoimmune. Some cases they don't ever really figure out what causes it. This can be acute and self-limited, so they can have it one time, recover it, or it can be chronic. Acute thrombocytopenia most often occurs after some type of viral illness. So what happens, there's an autoimmune response, usually that destroys the platelets. And because of that thrombocytopenia, there's a risk of hemorrhage. The diagnosis, if the platelet count is below 20,000, other disorders have to be ruled out because this is idiopathic thrombocytopenia. So if there's a reason for it, it's not idiopathic. Okay, so other disorders ruled out. Most children who have this actually have absent or minimal bleeding, but they are at risk. They have normal bone marrow, and it may either have normal platelets and eosinophils, normal platelets or increased immature platelets and eosinophils. Usually management is supportive. Those cases are self-limited. Their activities restricted to prevent injury as long if they have active bleeding or if their platelets are low. If they treat, typically it's going to be to try to stop that autoimmune response. Prednisone, IVIG is immune globulin or anti-D antibody may be given. But if they give anti-D antibody, you need to know that it causes a temporary hemolytic anemia. They'll break down a lot of red blood cells, be very anemic, and then start to rebuild. If ITP becomes chronic, then a splenectomy might be done. That typically causes or leads to long-term remission and decreases the risk of hemorrhage. But remember, splenectomy increases the lifetime risk of sepsis. Okay. All right. We will talk about disseminated intravascular coagulation in the next section.